Yes, good afternoon, ladies and gentlemen. My name is Gichuyia Nthuraku, and I work for the Tharaka Nithi County Government as the CEC member for Health Services and Sanitation. We are studying outside our first isolation unit just behind us, where we have 2 patients that we have isolated having tested positive for coronavirus. One whose specimen was taken on 9th of July, and the other one taken on 13th of July. We have instituted the protocols, the guidelines, and the standard operation procedures that are required to be operational whenever we have a positive case of coronavirus. These are not self-generated protocols. These are protocols and guidelines that are generated by the World Health Organization standards, by the National Ministry of Health, and by us as a ministry, as a Department of Health Services and Sanitation. We are bound by standard procedures, by professionalism, and all the other guidelines that we have learned in our basic training to take care of patients. Therefore, I just want to assure the people of the Tharaka Nithi County that we are taking care of these COVID-19 positive patients with human dignity, and we are attending to their needs in terms of nutritional concerns, in terms of other things that they need, water, etc., etc. We thank God that they are not very sick. They don't have need for intensive care, but we are continuing to observe the vital signs, which includes taking history, taking measurements, vital signs like blood pressure, temperature, respiratory rates, and others that are necessary. For now, they are comfortable, but it has been brought to my notice that one of them is complaining that she has not eaten. I heard that one yesterday, and I confirmed indeed she had eaten. There was even a nursing officer who is in charge of this hospital, who is right behind us, who confirmed that the patient had been fed. And the stories that I've heard that she has not eaten are stories that we can confidently refute by saying that the people who are supposed to feed her did their duties. And I've also instructed the officers in this hospital that to make sure that we document what it is that we are doing in those areas, we need to capture every activity so that it will be unrefutable evidence that the claims by the patient are not founded. We may not know what intentions the patient has, and it is inconceivable that any of us can design to feed one patient and leave the other one. That is not something that I've had in the whole of my life as a medical practitioner. What I can say is that the same patient was admitted somewhere else in another institution, and she just ran away. She escaped from that facility where she had been isolated before we took her in. Therefore, it is not our duty to condemn a patient, regardless of your malfeasant behaviors, regardless of what else you do that might be extremely annoying from a professional viewpoint. We cannot form an opinion to punish anybody, any patient, but we have also to obligate ourselves to give the correct position. We still love our patient, and we continue showing compassion and care according to the standards of practice, and we shall not end there. All the patients, regardless of where you are suffering from, you have the right to be taken care of. And of course, if the patient has any complaint, then mechanisms are there where she can complain, and then we address her complaints. So ladies and gentlemen, that's what I wanted to say, and that the Tharaka Nithi County Department of Health Services and Sanitation is prepared and ready to attend to patients, whether it is coronavirus or other highly infectious diseases. We are ready and willing, because we continue even to handle others in this same facility.